So this is known as the eighth thumb deformity. Now another sign which could be seen, that is due to the abductor pollicis brevis in the thenar muscles. Also it is in the thenar muscles. Ab- Abductor pollicis brevis. Brevis is non-functional, so we can do check it by pen test. As I have said, that except radial nerve, because the radial nerve is so much obvious, we have some tests to see clinically which nerve is involved at which level. So the pen test. So this is the pen test. If the function of abductor pollicis is normal, then he could touch the pen, which is vertically above him, above the thumb. And also there is called another sign is Oshner's claw hand, Oshner's clasp test. It is same as pointing index. Just you need to say the patient to clasp. I am showing that picture also. This is the picture. So, as in the pointing index finger, only one hand of the index finger won't be able to flex. So, when the patient is asked to clasp the hands, the patient cannot clasp. So, this is only the Oshner's clasp test. There is another thing in surgery called Oshner's Seren regime, but you need not know that. So, I am showing you the tests, demonstrating you the test, how it is performed. So, in the pen test, I have a pen. I would keep it in front of the patient and I would tell to touch the pen. See, I am able to touch the pen, so I don't have any problem with the abductor pollicis brevis function. But the patient with median nerve would have an eighth thumb deformity like this, and he won't be able to abduct the thumb to touch the pen. This is the pen test. And Oshner clasp test, it is same as the pointing index finger. You need to tell the patient to clasp like this, as one of the index finger won't be able to flex. So when the patient will do like this, it will be present, and you can demonstrate it clinically. Now the median nerve is also over, and so moving on to the last nerve, the ulnar nerve. Oh, sorry, the carpal tunnel syndrome I have not told. I'm telling that. That is in the location B if the damage is there. Carpal tunnel syndrome comes as short note also sometimes may come because of the clinical integration. So the etiologies, I would tell some of the etiology. In case of hypothyroidism, as there is a myxedema component, so the soft tissues expand and the nerve is gets compressed. Diabetes mellitus also it occurs in pregnancy. It occurs amyloidosis sometimes. Also in the trauma also it can occur. It is a type of compression neuropathy only. So in carpal tunnel syndrome, as you can see, the damage is here. So the flexors of the arm are spared, but the thinner muscles and the digital supply is not spared, and the lumbricals are involved. But the palmar cutaneous nerve is spared because it is giving supply before the flexor retinaculum only. Superficial to it, it is passing. So the palmar sensation would remain intact. So here also you would get the ape thumb deformity. And sensory loss only in lateral 3.5 fingers. So this completes the median nerve also. Now moving to the last nerve, the ulnar nerve. Ulnar nerve, also called the musician's nerve, because it supplies all the intrinsic muscles of the hand, most of the intrinsic muscles. And as you know, the little and the ring finger is very much involved in playing guitar, sitar, or any kind of instrument. So it is also called the musician's nerve. And let's draw again the simplified diagram of humerus and flexor retinaculum. Also, I am drawing here. Passes superficial to it. Um, it passes behind the medial epicondyle. That's why humerus is called the funny bone, because if you tickle in the ulnar nerve, you get the lightning sensation, the electrical sensation. That's why it's called the uh, humerus as the funny bone. And in the forearm, it only supplies, as I have told, the flexor digitorum profundus medial to it, but I am not mentioning it. And it's going superficial to here is one canal, I will name it, and it's giving off branches. Here you need not remember the level of injuries, mainly in the lower, only in the Guyon's canal only the injury occurs. So another also can occur, the cubital. Oh, wait, let me see. As I have told that all the nerves, the major nerves, they pass through the muscles, two heads of muscles. So here also it passes through the flexor carpi ulnaris, two heads of the flexor carpi ulnaris, and this is known as cubital tunnel. I think this was asked in any year of the NEET exam, so it is an important thing you need to remember. It is there in Vishram also, cubital tunnel. And naming of the branches: FDP, medial medial half, means medial to heads it is supplied. Then it goes through the Guyon's canal, and then the superficial. There is a superficial branch and a deep branch. So the superficial branch mainly gives supply to the palmaris brevis, a vestigial muscle, like it is also a superficial muscle, subcutaneous muscle like that of the platysma. The cows have much of the superficial muscle, so they could, when the flies sit on their uh, on them, it could make the flies fly off, as you have seen the movement in the cows. So for us, it is more than a vestigial muscle only. The platysma we can move hardly. Then it gives supply to the hypothenar eminence, All intrinsic muscles means all intrinsic muscle that does not that is not supplied by the median nerve is only supplied by the ulnar nerve. Hypothenar muscles, interossei, and lumbricals L3, L4, and here is the adductor pollicis. So adductor pollicis means this is the last supply of the ulnar nerve. So adductor pollicis is also called as the graveyard of ulnar nerve. Adductor pollicis is also known as the graveyard of ulnar nerve, and due to the injury to adductor pollicis only, we can elicit a sign, clinical sign, the Fromet sign. And as you know that from the PAD and DAB mnemonic that palmar interossei are involved in the palmar interossei are involved in adduction and the dorsal interossei are involved in abduction. So the palmar interossei it is involved. So it is involved and it gives rise to card test positive. Now showing the test. And the other test, that is the card test. I think this test are mentioned in your book also, so that's why I am mentioning this test. One. Mm, this diagram is good enough. So I am demonstrating the test, or else you won't be able to understand. I am using a scale as a card only. So the Fromet sign, that is the abductor pollicis, the adductor pollicis, that is the adduction of the pollicis muscle. So if the from a sign is said to be positive when if a normal person, see like me, I can hold this by keeping my thumb in the same line, but whose adductor brevis is non-functional, so he can't hold, it would slip. So what he does is that he utilizes the flexor function. The flexor function, so the thumb would bend at the proximal interphalangeal joint, the interphalangeal joint, and it would be like this. The thumb won't be in the straight line. It would be like this in the second picture, as you can see here in the second picture. Like this, the thumb would be. It won't be in the straight line. It won't be in the straight line. It would be a little bit flexed. So this is called a positive Fromet sign. And in case of card test, that is the palmar interossei can do the adduction. As you know, the middle finger is the line of line axis of the line, so it can do the adduction. Means if you use a card, introduce a card, and tell a normal person to hold, then he would be fine to hold the card. like you can't separate the card with minimal force. But whose the ulnar nerve is damaged, so the adduction function would be lost. So when you give a card and pull it, it would slip off, simply slip off. So this is called the positive card test. These are the demonstrations. Now I would say a rather hot topic, because it's an extra information not required for means your year, but those who want to give gold medal and CA exam, it can be asked if the teacher knows. That is tardy ulnar nerve palsy. So as you know that the ulnar nerve passes behind the medial malleolus. So sorry, in case of fracture of the lateral malleolus, I would give you remembering techniques for the coxa vera, coxa valga, genu vera, genu valgum, and also cubital vera, cubital valgus. So when there is a lateral malleolar fracture and there is non-union, so what happens that the axis of the humerus, it bends like this when there. So as it has bent, so you know that ulnar nerve is passing behind it. It would create a traction because it is going on to form the cubital valgus, because due to non-union there is cubital valgus. Now how to remember it is cubital valgus? What is valgus? What is verum? So valgus, remember that there is L. So L for lateral means the axis would be deviated to the lateral side, and the carrying angle would increase, as you know from that carrying angle concept. And in case of verum deformity, it could see in the means exact opposite thing, that is the medial epicondyle fracture, the verum, it would be medial. Now, remembering technique for the more commonly the genu vera and genu valgum is asked. So genu means anytime the axis the angle increases, then it is valgus or valgum, that deformity, or coxa valgum, coxa vera is the angle would decrease, but it's difficult when I am saying that. So easy remembering technique for the the genu verum and genu valgum. So it is the deformity of the knee, as you know. So in coxa verum, this is the feet. Verum, there is rum. So place a rum bottle over there. If you place a rum bottle in between, so the angle would obviously decrease in between, and that is called verum. And to remember for valgum, genu valgum. So there is gum. Gum means adhesive. So there is adhesive in between the two knees. So it is causing the increase in the angle. Increase in the angle. So this way you can remember from valgus lateral and verum, a rum bottle is there, and from valgum gum is there. Now in which cases scenarios it is seen, I am also telling that that is also not required. This is not required for you. That here you can draw a O in between. Here you can draw a O in between. So it is seen in osteoarthritis. And here you can draw an R-like thing. So it is seen in rheumatoid arthritis. This is an orthopedics and medicine concept I am telling you with that. So let's come back to the fact that where I was, because it is leading to a valgus deformity. There is a traction in the ulnar nerve, tractional damage, ulnar nerve. This is only tardy ulnar nerve palsy that is seen in lateral epicondyle fracture. So this is a hot concept, and I would be winding up slowly. So Another thing that is very commonly taught is the Arb's palsy and the uh, Klumpke's paralysis. This is very much common question, and it would come Klump Klump Klumpke's palsy. So this is very much common, and you all know where is the damage. So I need not tell about this. Just one fact that you know the deformities and all. But as the T1 is involved, there could be a Horner syndrome seen in the Klumpke's paralysis. Horner syndrome is in your is in your head neck topic also. So Horner syndrome you can remember by Maple manifestations. M for meiosis, A for anhydrosis, P for ptosis. Why it is occurring, you know, because the sympathetic supply is gone. L for E for enophthalmos. L I have forgot. Sorry, but L I have forgot. But meiosis, anhydrosis, ptosis, and enophthalmosis same in cases of Horner syndrome. This is the mnemonic. And let's come into the last part, that is the compression neuropathies. Carpal tunnel, as you know, the median nerve is involved. Carpal tunnel, median nerve. Thoracic outlet syndrome. It's more compression of the vascular structure, that is the SBC, uh, and the supraclavicular artery. Artery is compressed more. Then, as you know, the cubital tunnel syndrome is ulnar nerve. Guyon's canal syndrome also, it is the ulnar nerve. Then chiralgia paresthetica, chiralgia paresthetica. It is a superficial branch of radial nerve. So this is up for today. I am revising from the first. These I have said. So today's session, what we have discussed, the median nerve, the schematic diagram you need to draw in case that it is asked in the exam. So the supply, the supracondylar fracture, the pronatatory syndrome, Struther syndrome, the clinical features. What you can see, I have demonstrated myself in the video, so I think it would be clear after that, because these clinical signs are not shown generally, because the online classes you are not able to see them unless you see the YouTube videos. And then the carpal tunnel syndrome, within that only the musicians nerve, the ulnar nerve, and the palsies, the card test, and the Fromet sign. And a hot topic, that is the tardial nerves palsy also I have said, and I have said you the trick to remember the valgus and the varum deformities and where it is seen. And Klumpke's and Erb's palsy, you can study it yourself, nothing complicated and high scoring topics. So this is, I think, from my side. Is there any doubts from anyone? Any difficulty in understanding? Because if you ask higher level than this, I may not know, because I know superficially only anatomy. That is how much it is required in the PG and all. Not like you guys. I have not studied for 4 years such details. So any queries? কারো কিছু কোয়েরি আছে কি, বা কোনো অন্য কোনো জিনিস যেটা বলার দরকার আছে, বা কোনো অন্য কোনো সেশন যদি অ্যারেঞ্জ করা হয় কিসের উপর হওয়া উচিত, কোনো সাজেশন? By the way, I am having a tea time, so you can say. বোঝা গেছে তো আজকে মোটামুটি যা যা ডিসকাস করা হয়েছে? একটু সিম্পলিফাইড ফাইড ওয়েতেই বোঝানোর চেষ্টা করেছি। ও হ্যাঁ হ্যাঁ হ্যাঁ, একটা যদি এক্সরে, যদি if you want me to do, then I can do the X-ray part also. মেসেজ করেছে, ওকে। There would be pointing index and pointing finger and carpal tunnel syndrome. No, carpal tunnel syndrome, there won't be pointing index finger, because the flexor digitorum profundus is supplied much before the flexor retinaculum. So there won't be any carpal means pointing index finger, but there would be definitely a thumb deformity. এক্সরে কি দেখিয়েছে? এক্সরে মানে এক্সরে কি দেখিয়েছে মানে কোনটা কোনটা বলতে হবে? হ্যান্ডের এক্সরে তো মোস্ট কমনলি দেয়, হেড নেকেরও একটু দেয় মনে হয়, অ্যান্ড চেস্ট এক্সরে দেয়। আর কি দিয়েছে যদি কেউ ইয়ে চ্যাটে লিখে দিতে পারে, দেন ইট উড বি গুড। ক্যারিং অ্যাঙ্গেল, আচ্ছা।